Disease can rob anyone of the ability of leading a normal life, and in some circumstances, people who lose mobility can have a hard time staying socially active. In the best case scenario, disease can be managed in the spare moments of a rapid, busy life, but even then, finding the information needed has to be fast, concise, and reliable. 72% of Americans search for health information online according to a 2013 Pew study. Whether we are searching for the best dietary plan, diagnosis that matches our symptoms, the answers to our doubts regarding prescription drugs and their side effects, or just an empathetic soul who can listen to our story and share their experiences with the same struggle we are going through, we all engage in interactions within the online health community. So, what exactly is an online community? First, let us define the word community. A community is defined broadly as a formal or informal group with a common interest, such as a shared characteristic like geography, race, or ethnicity, a shared medical diagnosis, or a combination of all. For example, a community could be a neighborhood in a city, an ethnic community center, or an online health community of individuals affected by cancer. On the other hand, an online community is a group of people with common interests who interact in a virtual environment using the internet, websites, emails, and/or instant messaging to communicate with and learn from each other and pursue common interests over time. The internet is a very important tool, having become the first engine of research for many. This ever-growing source of information serves as an interface between patients and healthcare providers. Consumers cite the internet as a popular and useful source of health information, with approximately 60% of U.S. adults regularly seeking health information online. So, what are the advantages, disadvantages, and challenges people encounter with this research modality? This is what Dr. Jill Yamasaki, a health communication professor at the University of Houston, had to say about the topic.
There are some clear advantages to online health communities. One is you're able to seek information from people who have similar illnesses. That can be very advantageous, especially if you're dealing with something like addiction or mental illness that has a large stigma. It's also helpful to get information from people who are going through what you're going through. There are some disadvantages also, some harmful effects of being on an online community, and one of the big ones is it's isolating. You are alone, you are in your room, anonymous. So while these weak ties can be very effective and very fulfilling, on the other hand, you're missing then those strong ties. And people with low health literacy, people who aren't able to understand and discern among the types of information, or people who are unable to use computers, who don't have those resources, may have a difficult time also.
Among the many advantages, connectivity is one of them. Health online communities are accessible around the globe using a computer, tablet, or smartphone. This is especially advantageous for those people who live in isolated rural areas, have a physical handicap that restricts their mobility, are hospitalized, or simply pressed by work schedules and other duties. They also allow people to communicate with each other, share their stories, and distribute information regarding main issues of interest to the community. They allow their members to expand their network of friends and associates and also give a sense of sympathy, connectedness, and reliance. Many online health communities offer good, useful, trustworthy, and reliable information regarding local health programs, treatment affordability, service accessibility, healthcare providers, or optional treatments, among other advantages. Online health communities allow people to have medical consultation from far location while speaking to healthcare providers in real time, do research or inquire about a topic of interest, connect with other people with similar issues, or purchase products from the comfort of their home, minimizing travel expenditures and other administrative costs. Among the disadvantages of online health communities, the biggest one is their online forums predominantly rely on inputting text, which can be challenging for those who can't write, spell, have poor keyboard skills, no access to a keyboard, or live with a disability that prevents them from reading text and using a keyboard. Text-based consultation can become tedious, time-consuming, and impersonal. Online discussions use mainly written communication, a medium which oftentimes lacks of physical cues and needs visual aids such as pictures to convey the right message. With no verbal or body language cues of real-life communication, disruptions and misunderstandings can oftentimes happen. Irony used by a person in written form can be easily misinterpreted by a different person not receiving all the cues or having a different sense of humor. Busy online websites, discussion threads, or forums can be overwhelming and hard to follow. Clarification of topics might not always be immediate and in some instances delayed up to 48 hours or more. Due to the high volume of people visiting a site or commenting on a thread, off-topic discussions are very common and can further delay the time spent with the subject. Standardized services are not all-inclusive and at times not applicable to everyone. Another challenge that people have when looking for online health communities is to discern what community best serves their interests and needs. Of the people who said they went online to self-diagnose, less than half, that is 41%, said that a doctor confirmed the diagnosis they made from an online research. 35% said they did not seek a professional opinion, and 18% said the medical professional or clinician did not agree with what they had found. So why do people still come together in online health communities? Is it only because the internet allows people with similar conditions to connect with each other and share their stories? Truth is, we live in a world of scientific progress in which big words are inevitable and permeate the medical field, and it seems like doctors and patients speak completely different languages. Due to the huge discrepancy between the medical educated professional and the average person with scarce knowledge of medical concepts, the common ground is the online health community. Here, the collective stories circulating on platforms like the social media such as Facebook and health-related forums such as healthcommunity.com give a sense of belonging, social and emotional bonding, and support. In 2003, Google reported that 6.75 million of their daily search logs were health-related, and in 2012, Google searches accounted for around two-thirds of the U.S. Internet searching. In 2013, about 77% of online health information seekers stated that they used websites such as Google, Bing, or Yahoo. 13% visited specialized websites such as WebMD. 2% visited more general websites such as Wikipedia, and 1% began their online health information research with a social network through websites such as Facebook. Among the many online health community platforms, we can find those that contain multiple illness forums and were sponsored by large medical or commercial sponsors such as WebMD, Yahoo.com, or HealthBoards.com. Regardless of illness, the most common categories of interest address topics like prescriptions and over-the-counter medications, behavioral therapy such as a diet or smoking cessation, alternative therapies such as alternative medicine or complementary treatments like acupuncture, and information regarding medical procedures. Due to current technological advances in the past decades, chronic disease have become the prevalent type of conditions people have to deal with nowadays. According to the World Health Organization in 2014, 60% of deaths worldwide were caused by chronic disease. An important component of our life quality is self-management and self-efficacy of chronic diseases. Patients actively discuss chronic diseases within online health communities, often without the supervision or the guidance of a healthcare professional. A study that focused on an online health community of people with arthritis found that the improved self-efficacy was due to opinion leaders that facilitated the process for all the members of the community. The increased interactions of people in the 21st century has allowed everyone to benefit from these communities by making available more personalized care, tailored information, social and emotional support, as well as increased availability of information and surveillance of potential public health problems that ultimately help shape our health policies. Whether born in the 20th or 21st century, one thing is certain: we can no longer exist in nowadays environment without pertaining and being involved in online health communities.